Pregnancy comes with many changes. Some symptoms are completely normal, but others can be warning signs that should never be ignored. In this video, we'll talk about 7 pregnancy symptoms that doctors take seriously. Knowing the difference between normal discomfort and danger signals can protect both you and your baby. This video is educational and not a substitute for medical care. If something feels wrong, always trust your instincts and speak to a healthcare professional. Symptom 1. Heavy vaginal bleeding. Light spotting can be normal in early pregnancy, but heavy bleeding is not. If you notice bleeding like a period, bright red blood, or bleeding with pain or dizziness, you should contact a doctor immediately. Heavy bleeding can be linked to miscarriage, placental problems, or other complications. It is always better to check early than wait. Symptom 2. Severe or persistent abdominal pain. Mild cramping can happen as your body changes, but severe, sharp, or ongoing abdominal pain is different. This includes pain that doesn't improve with rest, pain on one side, pain combined with bleeding, fever, or vomiting. Doctors may investigate causes like ectopic pregnancy, infections, or placental issues. Never ignore strong or worsening pain. Symptom 3. Severe headache or vision changes. Occasional headaches are common, but intense headaches, especially later in pregnancy, need attention. Warning signs include blurred vision, seeing flashing lights, sudden swelling of face or hands. These can be signs of high blood pressure disorders, such as preeclampsia. Early treatment is very important for safety. Symptom 4. Sudden swelling of face, hands, or feet. Some swelling is normal, especially in the feet, but sudden or extreme swelling is not. It may be linked to blood pressure problems. Doctors take this symptom seriously, especially in the second and third trimester. Symptom 5. Fever, with or without pain. A mild temperature can happen, but fever above 38 degrees Celsius should not be ignored. Fever during pregnancy can signal infection, flu, urinary or other bacterial issues. Infections during pregnancy may affect the baby if untreated. Always report fever to your healthcare provider. Symptom 6. Reduced or no baby movements. As pregnancy progresses, most mothers become familiar with their baby's movement pattern. If you notice a sudden decrease in movement or no movement at all for several hours, you should seek medical advice immediately. Reduced movements can sometimes indicate that the baby is under stress. Doctors prefer checking early rather than too late. Symptom 7. Chest pain or shortness of breath. Mild breathlessness can be normal, but sudden chest pain, tightness, or severe shortness of breath is not. This may be linked to blood clots, heart or lung conditions. These situations require urgent medical care. Important reminder: reassurance. Not every symptom means something is wrong. Many women experience discomfort and go on to have healthy pregnancies, but these 7 symptoms should never be ignored. Early medical care can prevent serious complications. Call to calm action. If you found this video helpful, consider sharing it with someone who may need this information. Subscribe for calm, reliable pregnancy and newborn guidance. And remember, when in doubt, always consult a healthcare professional. Your health and your baby's safety come first. Why